sponsor and promote this webinar on health and sustainability and the interaction between the two of them. I'd like to take a moment to tell you a little bit about PERC if you're not familiar. Many of you joining us are from member schools, but many are from other partners and alliances we'd like to build as partners. So PERC is a consortium of over 50 of Pennsylvania's higher education campuses. Our mission statement says that we share knowledge and take action toward enhancing sustainability, and that's both on campus and off. Some of the programs we have are focused on campus sustainability. For example, the Pennsylvania Higher Education Food Recovery Challenge is something that we partner with the US EPA and also with our sponsor of that, Sodexo, and that's a whole complex initiative that's been running for a number of years, but it's won, I think, 5 or 6 awards from the US EPA over the years, some going to specific campuses, some going to the effort as a whole. We also focus on the connecting campuses and communities around sustainability. And we have conferences and webinars around that, as well as student-led or student-initiated workshops and conferences and other efforts. Actually, there's a student engagement component within the Food Recovery Challenge. So a lot of these things overlap. We've had a number of things on how to drive sustainability through the curriculum as a whole. And we try to build government alliances. We have one with DEP with the climate change intern program they have going on. Working with Heidi Kunke at DEP on that. DCNR, we were the partner organization when DCNR got their Thinking Outside program started. We have several institutions engaged in that. PERC is made possible by, hey, I sound like a PBS show. PERC is made possible by member institution dues and sponsorships. Find out more about us at pagreencolleges.org, and we have Facebook and Twitter feeds as well. That's my nickel overview of PERC. And welcome again.
Okay, thank you, Josh. Good morning, everyone. I want to welcome you to the Sustainability and Public Health Partners by Nature presentation. I'm going to start with just a few housekeeping items before we start. I want everyone to know that this will be recorded, so if you have some colleagues who could not join us today, they will be able to access this in the future. Also, if you're new to Zoom, there is a way to minimize the videos on the right-hand side. If you click on it, there's to the very left-hand side, you can actually, it says hide thumbnail video. You can hide all the videos. Or if you want to see just the person talking, you can hit the one next to it, to the right of that. And then the last one is show thumbnail video, which shows all the videos of all the speakers. But I just wanted to let you know that because you can minimize that if you want to be able to see the entire screen. Next one, there will be periods throughout the presentation when we will stop for questions. So if you move your mouse down to the bottom, it says chat. If you click on that, you can start typing in your message. Also, we want to note that we will not be explicitly talking about COVID-19 on this presentation. And last but not least, there will be an evaluation survey for you to complete at the end of the webinar. It's only 5 questions, so please take the time to complete it. We would thank you for helping us with that. Now I want to move on to the coordinating committee. I want to thank everyone who made this webinar possible. First, Peter Boger. He is the Assistant Director for Community Engagement at the Penn State Sustainability Institute. Peter Buck is the President-elect to the Pennsylvania Environmental Resource Consortium. Lisa Davis is the Director at Pennsylvania Office of Rural Health. Josh Hooper, who you've just heard from, is the Director at the Pennsylvania Environmental Resource Consortium. Ruth McDermott-Levy is the Director at the Center for Global and Public Health at Villanova University. And Kishbal, the Director for Cancer Prevention and Control at the Pennsylvania Department of Health. Today's agenda. So over the last few years, leaders in community and public health and in sustainable development have converged to address the unsustainable patterns of social and environment or economic development that are impacting the health and well-being of individuals, communities, and the natural world. This webinar will provide you with detailed information regarding what sustainability and sustainability development is, what public health is, and where these fields intersect. This is a very timely and important conversation. We recognize that there are some very different opinions around sustainability. We also understand the need for ongoing productive conversations in order to build consensus and develop strategies to address the issues in a meaningful and sustainable way. We want you to think about how your current work intersects with the sustainability goals you will hear about today, and where there are opportunities to develop new partnerships and leverage resources to address the issues and build a healthy future. We will provide examples of productive overlaps and future opportunities. There will be time for discussion, and we'll finish with next steps and action items for you to take away from this presentation. We hope to build a platform for sharing information and developing action plans for community engagement, education, research, policy development, and funding, and hopefully kickstart a new initiative where recommendations regarding policies and programmatic goals can be addressed. I would now like to turn it over to Peter Buck. Peter.
Thank you so much.
Wow.
Why is that happening? I'm really sorry about this.
Stand by for 1 second, everybody.
I had a ghost Zoom window open. So my apologies. Can you hear me okay? Okay. Can you move to the next slide, Peter? Thank you very much. So at the Sustainability Institute and in much of the sustainability literature, we take as fundamental a couple of studies that inform a lot of our practice. And the first of these is the Great Acceleration. So I would draw your attention to the two sides of this, this graphic. So on the left, we see socioeconomic trends, and on the right, we see Earth system trends. You'll notice the common shape between the two, and that shows a kind of interconnectedness and an inextricable interconnectedness between how people live, what we do, what we move around, and their impact on the natural world depicted on the right. So on the left, ranging from world population, real GDP, primary energy use, and fertilizer consumption, you'll see that kind of exponential uptick. And there's a line there that you can see moving toward the right, and that is the year 1950. And in the research that's been conducted by Will Steffen and others, they've found that there is an inflection point in global economic productivity, population, and material and energy use, food production, water use that ticks up rapidly in 1950. And understanding the basics of thermodynamics and that everything comes from somewhere and must go somewhere, we see on the right some of the trends that happen that positively correlate and are caused by those things on the left, including growing greenhouse gas emissions that lead to climate change, the acidification of the ocean, and then, of course, things like the input of coastal nitrogen and rising nitrogen concentrations in estuaries and bays around the world. And move on to the next slide. In other depictions, Stefan and others, Rockstrom, have depicted this in another way, which is to try to understand where human activities may be overshooting certain planetary boundaries. So in the graphic that's on the left, you can see these 9 areas going from biosphere integrity, climate change, quote unquote novel entities, which are chemicals introduced into the environment, stratospheric ozone depletion, atmospheric aerosol loading, ocean acidification, biogeochemical flows, freshwater use, and land system change, that human activities, which were those depicted on the left in the previous graphic, are pushing on boundaries that exist in nature. And so you can see, for example, and I understand it's small on the screen, I would encourage you to look at this paper, that, for example, genetic diversity is severely constrained, and we may have already exceeded a planetary boundary there. We can also see that, for example, phosphorus and nitrogen entering into waterways through agricultural production, for example, are seriously pushing on the thresholds that are out there. We don't know exactly where all of those are, but we are increasingly facing the fact that human activities have repercussions on the environment. And what we want to make clear here is that by pushing on those boundaries, we are in fact pushing a great deal on ourselves. Peter, next slide. So in 2015, the world came together, 190 nations agreed through the United Nations that we should be pursuing 17 Sustainable Development Goals. These followed on the heels of the Millennium Development Goals, but this time around, the recognition of that inextricable link between human activities and the health of nature came to be seen as much more tightly linked. And so the UN created this framework in order to work on society, the economy, and the environment synergistically. A lot of people, when we think of sustainability, will just think of something like recycling or home energy efficiency or low flush toilets. And they'll think about it purely as it's connected to the environment. What the SDGs, as we'll call them now, the Sustainable Development Goals, try to do is to create a comprehensive framework that has linkages between each goals so that there can be synergies between them. We also recognize very clearly that there are also going to be trade-offs between some pursuits and others. We don't live in a world of, I don't know, bubblegum and unicorns where everything is free. Not at all. There are always going to be trade-offs, but those synergies are the things that we are looking for. And on this webinar, what our group is attempting to do is to focus on how, if we put good health at the center, where linkages across economy, society, and environment may be. Next slide. So this gives a little bit more of a background on the Sustainable Development Goals. And you can see here that under Goal 3, there are 9 main targets connected to maternal mortality, very young mortality, the end of epidemics, reducing premature mortality, strengthening prevention and treatment of substance abuse, have global death and injuries from road traffic accidents, universal access to sexual and reproductive health care, achieve universal health coverage, and reduce deaths, illnesses from air, water, and soil pollution. I think right there you can already see some of those linkages to environmental health, to the social determinants of health, and connections to our infrastructure, how we build it, how we manage it, even the materials that we use to fuel our economy, and the impacts that they can have back on us as individuals, community, and a world. Next slide. So when we think about the Sustainable Development Goals, you can see here the connection between economy, society, and the biosphere. And I should say that this all flows from a definition of sustainable development that came to be in the mid-1980s through what's called Our Common Future, a report at the UN published under the guidance of Gro Harlem Brundtland, the former Prime Minister of Norway. And they wrote that sustainable development is development that meets the needs of current generations without compromising the ability of future generations to meet their needs. And to meet our needs, we obviously have to have economic productivity and work. We have to have functional, healthy societies, and we are nested within a biosphere that takes care of us. So the idea is a kind of circular view of integrated health through economic, social, and environmental practice. This graphic shows you at the bottom there the goals that are connected to the biosphere, such as life on land and preservation of life on water, and then society, ranging from the ending of poverty, good health and well-being, quality education, and gender equality. And moving up, we can see the economy there, including connections to infrastructure and responsible production and consumption. And very importantly, and sort of over top of all of this, and I think what we're trying to spur here is goal number 17, which is partnership for the goals. That if we hope to make progress on any of these, that we need to be working together. And as just a very quick note before we move on, I'll note that out of Columbia University, the Sustainable Development Solutions Network put together reports that are state-level reports. And out of the 50 states on achieving these 17 Sustainable Development Goals, Pennsylvania ranks 30th and appears to be unlikely to meet any of the 17 goals by 2030 in this, one of the most developed nations in the world. So we don't want to have rose-colored glasses on this call. We want to recognize the reality, but also recognize that on this call right now with the 70 plus of you and the 130 who have expressed interest, that there is a lot of possibility for really good action. So I will now turn it over to Lisa.
Thanks, Peter. This is Lisa Davis from the Office of Rural Health, and I'm going to be fielding questions, but it looks like at the moment we don't have any questions. So I think we will turn it back to our panelists. Please be sure and type your question into the chat box, and we will do our best to make sure that we address all of those questions when they come through. We also appreciate those of you who submitted questions ahead of time or indicated what you would like to learn through this webinar, and we hope to be addressing those as we move forward. So please feel free to put your questions into the chat box, and we'll have opportunities throughout the webinar to answer those questions. Thank you.
Thank you, Lisa and Peter. Can you hear me okay, everyone? Yeah? Okay.
I have one quick question. Can you provide a link to the state level reports? Are you able to put that into the chat box?
Yes, I am.
That out after? Great. Okay. Terrific. All right, Ruth, thank you very much. Sorry for the interruption.
Thank you. Thank you, Peter, for setting me up so nicely of making the connection between our built and natural environment and health. Before I move on, though, given what's going on, I really feel compelled to acknowledge our Pennsylvania Department of Health, our first responders, physicians, my nurse colleagues, and everyone else that's keeping the state moving during COVID-19. I can see out my window and I saw our trash collectors. So these are the people on the front lines keeping us moving. And this is public health. We are seeing it, public health in action. The definition from the World Health Organization is the art and science of preventing disease, prolonging life, and promoting health through the organized efforts of society. And so we're seeing right now what is organized and actually what we need to strengthen. Public health does rely on science. We rely on biostatistics, environmental sciences, epidemiology, and so we need to trust our scientists in what's happening. Next slide, please. So what do we do? And again, we're seeing this play out live in real time. Public health professionals monitor the status of health and identify community health problems. We're seeing that in, unfortunately, the constant numbers right now. But before that, we're also monitoring risk. And with COVID-19, we're seeing who is at risk, and they're sharing that. So they diagnose and investigate health problems, and of course, not just for infectious disease, but environmental exposures, risks of non-infectious disease or chronic disease. And then they also inform and educate others. And again, we are seeing that. Next slide, please. This slide is known as the Minnesota Wheel, created by the Minnesota Health Department, and it spells out all the activities of public health. Again, monitoring is very important. Educating the community with accurate real-time information is very important. And then making sure we have the proper policies to address whatever the issue might be. And then certainly evaluating that response and then going through again and monitoring. So it's constant checking of what is happening with your local community, statewide, nationally, and we're also seeing globally. Next slide, please. So this slide is very busy. And again, thinking of what's going on in the news, we're seeing who are the important players in public health. So certainly in the center, we have, the Pennsylvania Department of Health, and throughout the state, we do have some county level health departments. Not every county is represented, and maybe after this, we'll say we need to make sure that happens. But we also then have other organizations that are stepping up. Certainly our law enforcement, our first responders, mental health, our laboratories. And we also see in periods of crisis who might not need to be players in this. And so, again, it's very complex, and it is not just the health department, it's many organizations that are supporting the health of populations. Next slide, please. So Peter referred to social determinants of health, but we also have what's known as the overall determinants of health. And these are factors that influence health of populations. In the United States, we have what's known as Healthy People, and the current document we're working on is Healthy People 2020. It is the national goals for health for the nation. And so we are waiting for Healthy People 2030 to come out, but the determinants of health defined by Healthy People 2020 is biology and genetics. So these are the things that we typically think about when we think about health. What are our risk factors based on, our family histories and our genetic disposition, the health services that are available to us, and then individual behaviors such as, do we smoke? Do we get enough exercise? Certainly policies influence health, our Clean Air Act, our Clean Water Act. And then there's social factors. And so these are referred to as the determinants of health. When I talk to my students about the social determinants of health, I actually often say what we're born into. So these are the factors based on where we live, our socioeconomic status, our education, and these factors are very important in influencing health. As a matter of fact, they have a stronger influence than our genetic makeup. But they're also the much more difficult to manage and to address. And so getting to Peter's point about working through partnerships and working across different sectors, we really can make a difference on the health of Pennsylvanians. Next slide, please. So this again is showing the social determinants of health, where people live, their educational attainment, and we when we look across the state, we can see that there are different opportunities based on where someone lives. So our zip code really matters. And if our educational attainment is not that high, that influences economics. And then that can influence opportunities for people as far as even health insurance or what food they can purchase to maintain their health. Next slide, please. So this infographic really demonstrates the impacts of the social determinants of health. And as you can see, it has 40% of the overall impact of health. In the 1960s and 70s, Sir Michael Meerman did what's known as the Whitehall study, and that was conducted in England. And that really demonstrated how education and socioeconomic factors influence the health of others. And since that time, we've had many more studies to support his early findings. And again, but through partnership, we can really make a difference for the health of Pennsylvanians and looking at it from the view of sustainability. So the next, I'm going to pass this on to Peter Boger, and he's going to address the Sustainable Development Goals.
We do have a couple of questions. One is, will the PowerPoint presentation be made available? And yes, we will have that available. I'm going to rely on Peter Boger to be able to send that out to folks who have registered. And Peter, is that possible?
Yep, that and the recording of the call and the survey will all be coming out to you in an email this afternoon.
Excellent, Peter. Thank you so much. And then we had another question. What are the most pressing issues in Pennsylvania that we need to focus on to accelerate progress toward meeting the 2030 Sustainable Development Goals in Pennsylvania? And is any of our panelists willing to take that question?
Well, I think that actually sets up very nicely our next section. So maybe we'll just go ahead and go into that. So this is Peter Boger from the Sustainability Institute, the other Peter B in the Sustainability Institute. You've heard the first one already. And so in our next section, what we wanted to talk about was the Sustainable Development Goals in more depth individually, and really from a Pennsylvania perspective. As Peter and Ruth have both said, these are all very interconnected goals. And if you're trying to elevate one, you probably need to be working on the others. And one of the things we're excited about with this call is that we have people on this webinar who signed up from a wide range of backgrounds. Many of you are in public health fields or health fields, but many of you are coming at this from the sustainability side of the equation. And what we're hoping for is that you will start to see the work that you're doing doesn't need to change, but that in fact you have new partners and new potential allies. And how could you start to see that how your work connects to larger goals that may allow you to develop novel partnerships, novel innovations, and potentially go after bigger grants and different types of grants to support your work. So our hope is that as we go through these sustainable development goals and think about them in a health context and a Pennsylvania context, ideas for partnerships will emerge in your mind, and we can talk about them more in the discussion at the end of the call. But as Peter Buck had said before, there are these 17 goals, and it's worth kind of going through them one by one, especially since, as he said, Pennsylvania is not on track to meet a single one of these goals by 2030, which is the original goal of the SDGs. So thinking about poverty and all its forms, as Ruth just said, so much of an individual's health is based on social factors and social determinants, such as poverty and economic well-being. And so there are plenty of people who are on this call who work in fields of poverty, and it's worth starting to think about all the ways, which you probably already are, that poverty influences health, whether that's access to good nutrition, access to healthcare, or the environmental factors and pollutants that come from where people live, since so much of environmental loading of pollution disproportionately falls on low-income communities. And Pennsylvania right now sits smack dab in the middle of the nation in terms of our poverty rates overall. Similarly, if you're working on issues of hunger, that very much both directly and indirectly impacts people's overall health. We know in this state that we suffer from far too many people being hungry, whether it's 1 in 8 overall people struggling with hunger or 1 in 6 children. But it's worth thinking about the effects down the line. Recent reports that came out last year found that nearly half of all college students report being food insecure at some point in the month. And that has a lot to do with the fact that we have many older students going back to college, many students who have families, students now having to prioritize, do I spend money on tuition or on food or on medicine? And not only does the lack of hunger, or the hunger and the lack of food or lack of good food potentially impact their direct health, it affects their academic performance, which can in turn impact their overall ability to complete college and or then their economic well-being down the line. So starting to think about all these systemic impacts and these systemic connections helps us to see how work that we're doing in one area may be very important in overall promoting health or work in another area. As we've been talking about on this call, good health and well-being is our focus, and it's worth noting that in Pennsylvania, the leading cause of death currently is cardiovascular disease and cancer. And unfortunately, there's been a 14% increase between 2010 and 2017 in midlife mortality. I think everybody is well aware that some of these are causes of things like the opioid epidemic, but it's worth starting to think about through the lens of the SDGs, how that epidemic can be seen as having many distal and approximate causes related to economics, community health and well-being, strength of the economy, strength of community organizations, and that people who are working in those fields are in fact indirectly impacting health through making stronger and better communities, which may reduce overall issues of opioid use and other challenges. Similarly, education, with economics being such an important part of the social determinants of health, and education being so strongly linked to income, is an important consideration here. And here Pennsylvania is doing very poorly by almost any ranking. We currently rank 47th in the nation in terms of overall tax revenue going towards education. And in the last 10 years, have seen the steepest decline in tax revenue going towards education of any state in the country. We also have some of the highest and most costly college educations for students in the country. A report that came out last year found that amongst Big Ten schools, Penn State has the highest overall cost for in-state students of any school in the Big Ten, and that our students are graduating with some of the highest debt, whether they go to Penn State or any of the PASHE schools. And those debt loads have serious impacts on where students are able to live, where they're able to get jobs as they try to manage those debt loads going forward, which then in turn have knock-on effects on their overall health and well-being. Gender equality is an area that a lot of people don't think of when they think about sustainability. Again, as Peter Buck said, so often people think about sustainability in the realm of the environment. And gender equality is important both not only for sustainability, but also for issues of public health. A study has found that if we employed women and paid them the same rate as men in comparable positions, their poverty rate would be reduced by more than half, which would have significant impacts on their overall health and well-being. Similarly, a report by Drawdown, a group started by Paul Hawken to try to come up with 100 best solutions to mitigating greenhouse gas emissions into the atmosphere, and indeed starting to draw down the overall concentration of greenhouse gas emissions, found that promoting gender equality for women and girls around the world would be one of the 10 most effective solutions to actually addressing greenhouse gas emissions into the atmosphere. So even if you're not thinking, oh, I'm working on gender equality, that's not related, it is very much related to public health, and it's very much related to sustainability. And how can we start to think about creating novel partnerships amongst the people working in these fields in Pennsylvania? Obviously, the connection between clean water and sanitation to health is an important one. And here again, it's very frustrating. Pennsylvania has the highest density of surface water miles of any state in the nation, and yet we're not on track to achieve goal number 6 by 2030, and it's because we have the third worst rate of safe drinking water violations in the country, with almost half of our population drinking water with violations. And this is due to, in part, to the fact that we have the highest rate of combined sewer overflows from our aging sewage infrastructure, which allows lots of untreated sewage during storm events to spill out into our water supplies that can then lead to outbreaks of things like hepatitis A, salmonella, or giardia. just in the interest of there are so many SDGs, we're going to switch it over so that you don't just have to hear my voice, and we'll have Peter Buck take up the next few.
Great, thanks, Peter. Yeah, so Sustainable Development Goal 7 has to do with affordable and clean energy. Someone asked earlier what some of those things are that are most pressing in Pennsylvania, and among them are our energy economy. So we are obviously historically an extractive state with Drake's Well in Cherry Tree Township, and then Wren's Well being the first fracked well in Pennsylvania in Washington County. And while solar, wind, and geothermal energy are growing in Pennsylvania, they make a very small proportion of the energy mix right now. And the Sustainable Development Solutions Network does note that one of the worst areas for Pennsylvania in terms of state ranking have to do with our very carbon-heavy ecological footprint. And this will connect to Goal 13 that Peter will talk about later. Next slide. So decent work for all and sustainable economic growth, according to Keystone Progress, a report that they put out in the last year or so. They noted that Pennsylvania, that we are one of the most unequal states in the country. Our leading employers here are large institutions, which isn't very surprising. But we do have one of the lowest minimum wages in the country at $7.25 per hour, and that we are behind on that measure from all of our surrounding states. Next slide. So Pennsylvania's infrastructure, as Peter alluded to when he talked about our water infrastructure, is in pretty bad shape. So the infrastructure report card that came out a few years ago from the American Society for Civil Engineers notes that our levee management is middling, if not bad. But then when you look at transportation projects, water main breaks, in our stormwater and wastewater management, those have very clear human health impacts. And they also have significant impacts on other things related to healthcare and healthcare access. So if you take the convergence of the lack of rural broadband in Pennsylvania, aging roads in Pennsylvania, and the lack of support for rural healthcare infrastructure, something that Lisa Davis can speak to much more, you can see that there is a crisis boiling underneath the surface, and that significant investment in this area could do a lot of good. Next slide. So Pennsylvania has a pretty significant pollution burden, which is the ranking of the difference between people of color share of the population and their exposure to cancer-causing chemical pollution. We know and have known for over 20 years that communities of color in the United States, even when they are middle income or higher income families, are more likely to be exposed to more pollutants than white communities. And at Penn State, we were going to be hosting Dr. Robert Bullard, the father of environmental justice, on April 1st and 2nd, but under COVID-19, large gatherings of people have ceased. So we do hope to bring him back in the fall, and we would invite all of you to attend that as well, either in person or virtually, because we know that the pollution burden in Pennsylvania disproportionately impacts communities of color. But then we can also look at extractive industries' impacts on rural communities as well, and some of the, in some cases, foreseen and in other cases not foreseen consequences of those impacts. Next. So we also want to have cities and communities that are inclusive, safe, and resilient. This is connected to the, some of the previous slides as well, that we know that we have a high degree of particulate air pollution as well as other pollutant forms. And there are annual reports through groups such as Penn Environment that show us what our air pollution concentrations are in our cities and communities across Pennsylvania, and that Pennsylvania ranks very low in air pollution impacts. And on to the next slide. And then finally, for me anyway, and then we'll move on to Peter, responsible production and consumption. Pennsylvania is obviously historically a manufacturing state, and we have a large natural gas industry that has increasingly been moving into plastics, something that will come up in the next slide. The development of a quote unquote circular economy in Pennsylvania is lagging from other states, and the potential health impacts from the ethane cracker plant, for example, even though it doesn't make crackers, that's a misnomer in a way, that is located north of Pittsburgh, could really be quite significant. And so what are the alternative means, the circular means of production that we may be able to achieve in Pennsylvania and around the world? Peter will take climate action, slide or number 13.
So thank you, Peter. As Peter just mentioned, the cracker natural gas plastic plant is an example of something when we're thinking about climate action, in that this has been hailed as a great producer of jobs for the region. But at the same time, once it is fully online, it is expected to produce the equivalent amount of greenhouse gases annually of putting 500,000 cars on the road, which will also be wiping out all of the greenhouse gas reductions to date from every single solar project that has been produced in Pennsylvania thus far. And so this is a big concern. Pennsylvania as a state is the third largest emitter of greenhouse gases amongst the 50 states. And as we think about climate change going forward, we know that it's going to have significant impacts in terms of heat, increases in rain and flooding, increases in vector-borne diseases from insects. Already, Lyme disease is now the #1 source of workmen's compensation claims for workers in the DCNR, because Lyme or ticks and tick populations are surviving the milder winters and exploding in number. So there's a whole series of effects that we know that are coming to public health as a result of climate change. So thinking about what are the ways in which working on climate change and mitigating it and adapting to it will be critical to thinking about overall public health in Pennsylvania and around the country. As we've mentioned before, Pennsylvania has horrible problems with sewer overflows. We're also the largest contributor of nutrient runoff into the Chesapeake Bay from our agriculture and runoff of nitrogen and phosphorus. And so thinking about what are those impacts in terms of the overall ecological health of the region that we're part of, and how does this impact our streams and our waterways, is a critical connection between health and sustainability. But it's important to note too that it's not just about what are the problems, it's also about what are the opportunities. For example, here in Centre County, there's a program that was started by Clearwater Conservancy, one of our largest conservation organizations, in partnership with Penn State, called Centered Outdoors. And the idea was, how do we get people out using our parks, our forests, our trail systems, and being in the outdoors more? And they actually partnered with local physicians to have special prescription pads for people with depression, with obesity, with diabetes and other cardiovascular issues, to prescribe as part of their treatment time in the outdoors, and work with students to create a ranking of local trails so that people could know beforehand what's the gradient, what's the difficulty, is it paved, is it handicapped accessible, and trying to get people out and about. So thinking about these kinds of novel partnerships is important, because we are blessed as a state with more than 2 million acres of forest land across a vast section of the state. And so how do we think about connections between health and getting people outdoors and taking advantage of our natural resources as an asset, and not just thinking about what are the problems with our natural resources. Obviously, as Ruth talked about, and as I think is on the forefront of everybody's mind during COVID-19, having strong, responsive and reliable public institutions is a critical part of producing any kind of sustainable outcome and any kind of public health outcome. But it's also important to think about things like violence and safety. Pennsylvania's gun deaths have gone up every year since 2001, and also our incarceration rate. Amazingly, nearly 1,000 out of 100,000 people in Pennsylvania is incarcerated, and that horrifying rate only puts us middle of the pack in this country, which speaks to the fact that the U.S. incarcerates a higher percentage of its population than any other country in the world. And the effects that that has on human health and on community health, the ripple effects that it has in terms of lost income, lost family structure, and lost social cohesion is significant in terms of thinking about how do we address public health. And then finally, the last SDG, as Peter mentioned earlier, is really about building partnerships. And that's what we are hoping comes out of this call today. These are wicked problems. They require comprehensive engagement, and they require novel ideas and connections to be built between people who don't necessarily see themselves as working on the same issue, but when they reframe their work, suddenly see that their work is connected. And that's what we're hoping comes out of this call today. So we've just thrown a lot of information at you. I should mention, if any of these SDGs, if we cited a source at the bottom, when you get the slides should include a link in the notes for the slide to those specific sources. So that should hopefully help you go in depth if you want to follow up on any of these specific statistics. But are there any questions? And I'll turn that over to Lisa.
Thanks, Peter and Peter. Really appreciate that. I want to go back to the first question that we had right before these slides. And one was talking about the most pressing issues in Pennsylvania that we need to focus on to help accelerate the 2030 Sustainable Development Goals. And I'd be interested to know if, in fact, we were able to answer that question through the presentations that you two just made. So if that person who had asked that question would be willing just to let us know if we were able to provide that information, that would be great. Or if we're very glad to go into more detail if that would be helpful. We also have a few other questions. How can public health professionals address the sustainability goals, and are there examples that provide that intersection? And I think we may have talked about that during the last few presentations, but would be interested if that individual could let us know if we have in fact answered that question. That would be great. Ruth, was there anything that you wanted to add?
Well, as far as the public health professionals, I mean, the first ones that we could address or are being addressed related to health and well-being are the actions of the health department addressing both infectious and non-infectious or non-communicable diseases through their programs, as well as other organizations that are doing that. And then also looking at programs I know in Philadelphia that are looking at issues related to maternal mortality. So they're the real quick ones. But what we really want to also think about is how can we intersect and address with public health, address more broadly some of the other SDGs. I'm just trying to think of it, such as like clean air and clean water. How would they intersect to highlight the health impacts? And of course, we all know there are health impacts when we don't have clean air and clean water.
Thank you, Ruth. I'm sorry, Peter, go ahead.
Yeah, I think we'll touch on this, I think, in the next few slides. But one of the things that you all may be interested in is the well building standard. And we can put that into the chat box and follow up with it. But, you know, it's been put together so that so that we have a building standard that is geared toward making people well. And when combined with something like the Leadership in Energy and Environmental Design building standard, what you have is a way for architects, engineers, planners, public health, people to work together to create built environments that are genuinely healthy. So I think that's when Ruth McDermott Levy actually visited Penn State, one of the things that we had her do was to meet with some of our architecture faculty and graduate students to ask the question, what would happen if nurses were involved with the design of buildings? So I think that's the kind of question that we want to foster in an environment like this.
Thanks, Peter. And another question, can you walk through the logic about the statement that was made about gender equality and greenhouse emission reductions, and then sending the link to the resource, which I believe is on the slide that we'll be sending out. So the Peter who talked about that, if you would address that, that would be great.
So one of the ideas is that when you increase equality for women, a lot of that has to do with education and increasing control over a woman's own fertility and reproduction, as well as her economic well-being. And so as women have greater equality in terms of education, in terms of economic opportunity, typically the number of children they have reduces, and the age at which they have children becomes later. And so that in and of itself has significant impacts population-wise. And so if you add that up in terms of long-term effects on climate, that's one of the most significant ways that we can affect climate change, is just by controlling population. It also reduces rates of childhood mortality and increases overall health and well-being. It gives people more understanding of their environmental impacts. And so education in and of itself can also impact how people are using their resources. So it's a very indirect effect, but the drawdown is looking at these indirect effects, because you do need to think systemically when you're trying to tackle these problems. Would you add anything to that, Peter?
Yeah, I just answered the question in the chat to provide people with a link to Project Drawdown. Mm-hmm. One of the things that I think people ought to note is that actual solution in Drawdown is one of the more complicated and argued over solutions because of increasing amounts of consumption per woman. As a woman becomes more educated, as anyone becomes more educated up to a certain point, while she and her family may have tighter control over reproduction and have fewer children, can they swamp sort of carbon gains from from having fewer children, and it goes into consumption. So I think that's something that remains to be tested. All that being said, across the sustainability community, there is a deep commitment to women's rights, and that it is a good in and of itself, regardless of the carbon impact, because of all these other sort of, health measures, for example. So.
And if I might add, as we educate more women, or women are more educated, their children are healthier, and there are studies to support that. So that's very important. And the piece of women's consumption versus men's, we want to be very careful with that, because we don't want to not educate women because they don't have opportunities. So we need to be careful with that one.
So in the interest of time, because we started a few minutes late and we do want to allow people to get on with their day, we'll just quickly, I think, go through this next set of slides as a kind of example, and then we'll turn it over to Lisa for kind of continued conversation and discussion. But we just wanted to give an example of thinking through these systemic impacts and connections, and thinking about how when you start to draw these lines and kind of work your way backwards and forwards, you come up with novel questions or unexpected intersections that may be fruitful places for future collaborations or considerations. So thinking about climate change, we talked about direct effects on health a little bit earlier in terms of hotter days and in terms of greater disease vectors from insects. But it's also worth thinking about climate change and water and thinking about health. By 2080, we are forecast in Pennsylvania to have the climate that Georgia currently has. And that means places further to our south will be even hotter and more humid. And it's projected that that means, for example, that it will be too hot and too inefficient to have large concentrated animal feed operations, or CAFOs, where the big hog and chicken industries currently in North Carolina and in the Delmarva Peninsula, it'll be too inefficient for them to try to air condition those hog and chicken farms. So they're going to move north, and the place they're likely going to come to is Pennsylvania. And since Pennsylvania is already dealing with surface water quality issues and our nutrient loads into Chesapeake Bay, thinking about climate change, what does that mean in terms of long-term thinking about clean water and sanitation, and how do we prepare for this influx that's expected to come in the next 60 years due to climate change into our agricultural systems? Or you can think about the intersections of climate change and sustainable cities and communities. Peter talked earlier about particulate matter, and also on that slide, there was something related to access to parks. If we're thinking about how do we deal with ground level ozone or allergens, one of the things we want to think about is what are our solutions to that to make our cities livable and safe. People who are dealing with building parks or community gardens may not be thinking of themselves as dealing with climate change, but parks can reduce the urban heat island effect by as much as 2 to 9 degrees. And that has a significant impact on overall human health and deaths from cardiovascular disease due to stress related to heat. So thinking about those kinds of partnerships and those kind of intersections related to health. Similarly, Peter talked about affordable clean energy. Pennsylvania has one of the lowest renewable energy portfolio standards for solar of any of our neighboring states. I believe it's currently 0.5%, when many of our other states surrounding us have much higher portfolio standards for solar energy. So what would happen if we who are working in issues of energy thought about solar energy as it connects to climate change and all the impacts that that will have in terms of cutting air and water pollution, dealing with pollution that leads to breathing issues, neurological damage, heart attacks, etc. Again, trying to give examples of how you start to think back and forth across these systemic impacts and what are the kinds of novel solutions and partnerships we can come up with. Or thinking about how that solar energy would generate incredibly good paying new jobs that could redevelop our blighted brownfields and abandoned industrial sites in urban cities, which oftentimes now are just sitting vacant and can attract all sorts of problems in and of themselves, but are actually perfect sites to put in new solar installations. And so not only would it be providing good jobs, but it would be renewing our cities and our communities. Or thinking about, again, going back to parks and green space, Philadelphia has entered into a consent decree to address its problems of water pollution, not by doing massive renovations of some of its sewage systems, but by investing in 10,000 acres of green infrastructure over the next 25 years to reduce stormwater runoff by 85%. And so what are the ways in which that investment, which is intended to be about stormwater infrastructure and stormwater impacts, also creates parks and green spaces that make cities more livable and make them better for people and all sorts of health related issues. So these were just some examples we put together to get people to start thinking about these kinds of intersections. But I will turn it over to Ruth to kind of close us out in our conversation.
Actually, Peter.
Lisa.
It's all right. It's all right. Hi, everyone. Lisa Davis from the Office of Rural Health. As Ruth had mentioned earlier, she talked about Healthy People, which is developed at the federal level to really guide activities across the country to achieve healthy communities and healthy individuals. And Healthy People 2030 is under development. I did receive information the other day that the publication of that will be delayed a bit, but essentially we are looking at creating opportunities for healthy lives, eliminating health disparities, creating environments in which social activity, physical activity, and the economic viability of communities can be strong, promoting healthy development and healthy behaviors. I think getting back to the slide that Ruth was showing that shows the impact of behaviors on overall health. And it's so critical to engage leadership and key constituents. And one of the questions to us was whether or not we would be sharing this information with Governor Wolf, and also being able to share the information that we've presented here with students, because they are very much the future of public health and sustainability across the state and across the nation. And we did have a question saying that many of these problems will require policy and business interventions. And that is exactly what we are hoping to create through this public health and sustainability work that we are doing. I know that we have presented a great deal of information to you in the last hour, and it's a lot to be able to understand and assimilate and see how you might want to move forward. But really, we are focused on wanting to create a healthy Pennsylvania and a healthy nation. So next slide, please, Peter. So what are other ways to address sustainable development through a public health lens and vice versa? How can sustainable development view itself through a public health lens? Because so much of that is interchangeable. So what you will see, and next slide, please, what you'll see is that we really want to spur conversations here in Pennsylvania. We are in an incredibly diverse state. As someone who works in rural health, I can tell you that 48 of our 67 counties are considered to be predominantly rural. And up until the 2000 census, we were considered to be the most rural state in the nation. And we still are either number 6 or number 10, depending upon who's counting. But I tend to think of us still as number 1. But we do have very large urban areas, Pittsburgh and Philadelphia, with the rural J going along the northeastern border, the northern border against New York State, coming down through the central part of the state and curling up underneath Allegheny County, where Pittsburgh is located. We also have a very diverse economy in the state, and we do have large numbers of ethnically and racially diverse populations. So we have a lot that we need to bring together. So how can we do this? How can we bring together these perspectives and these histories? And how do we create public conversations and productive conversations that acknowledge the diversity of our state and that are respectful of the ways in which these diverse groups can come together to really focus on how we can create a vision and a plan for a healthy Pennsylvania. So next slide, please. So first of all, we want to say thank you, first of all, to all of our presenters for all of the great work that they have done, both prior to, during, and after this webinar. And we so appreciate all of you who have spent time with us today. We're very appreciative of you being able to come together. We have a lot of questions that have come through, but we also realize that we have been on the call now for about an hour and that you all have other things that you need to do during your day. So are there any pressing questions for the panelists that we have not been able to address while we have been on the call here? And I'll open that up to all of our presenters because they can see all of the questions that have come through. They're all being very silent. Just so you know, we do have access to all of the questions here, and we will be responding to those. You will be getting a survey after this presentation, and in that survey, we will be asking you to tell us how you would like to partner on this. We know that there are many of you out there who will be interested in coming together for further conversations based on the input that we get from the questions and your responses. We will be pulling together next steps. The group here of the panelists have a conference call scheduled very soon, and we will be reviewing all the information and making plans for how we move forward. we hope that we'll be able to continue to engage you as well as your colleagues and others who will be interested in moving all of this forward. And yes, the slides will be distributed. And Peter, I'm going to turn this over to you. Will we be able to have the chats and the questions and answers also distributed?
That is a good question. I am not sure I know the answer to that. We will definitely do our best to save that and share that with people, and certainly try to follow up with people about specific questions. But we'll try to find a way, even if it means we just have to go back and rewatch the video ourselves. But I will hopefully be able to save the chat when we are done and share that with people as well.
Great, thanks, Peter.
And
Peter?
Yeah, so I've responded to some of the questions in the that were in the Q&A, so that from sources like the World Health Organization, I've provided links to the WELL building standard, to the LEED building standard, things like that. So as we go through all of these comments, we should be able to provide feedback that provides reputable sources. There's a question here, or rather a comment about inflated jobs numbers. And so we can provide the jobs numbers, for example, for solar, which is now employing more people than coal, oil, and natural gas in the United States, although the median income in that field is not as high as it is from petroleum, for example. So we can provide some reputable sources so that people know that we are doing our best to not peddle nonsense, I'll say.
And I think, Peter, that also relates to one of the other questions that we had, showing leading employers, including the University of Pennsylvania and the city of Philadelphia, as the top three. Was that really for the entire state, or was that just for the southeastern portion of the state? So I think those are the kinds of questions that we might be able to follow up with rather than keep folks on the phone.
Yeah, may I address one other? So Joanna has asked us, many of these problems will require policy and business interventions, and what are the plans to engage the legislature and business leaders? And that's something that we've talked about a fair amount in our own discussions. I think that is probably something that is going to be up to whatever group or groups form out of this to decide. Peter and I, for example, work at Penn State Sustainability Institute. And while we certainly come to the table with a view about and for sustainability, the nature of our work sort of prevents us from engaging in a particular policy prescription or lobbying. However, any group that would form out of what we're doing here may end up doing that. And that, in our view, I think that would be an appropriate outcome.
All right, thank you. Well, I think we now can go ahead and close the webinar. We just want to say thank you so very much to all of you who have expressed interest in this. We're very excited about it, and that's why those of us who have been presenting today have been working on this since last August. So we very much appreciate your interest as well. And please, we've made the follow-up questionnaire very, very easy to fill out. So it should take you no more than 5 minutes, although you can spend a lot more time on it if you so choose. And we'll look forward to getting your responses. So my thanks again to all of our panelists today for all of their information, and to you for being able to be on the call with us today. So look forward to hearing from all of you, and our very, very best wishes that you all are well and stay well. Take good care now. Bye-bye.